A woman goes to the doctor complaining of stomach pain. The doctor orders an ultrasound. On the screen, they see something impossible. A mass in her ovary, with teeth, fully formed teeth, and what looks like an eye, staring back at them through the monitor. The woman screams. The doctor goes pale, because they both realize the same thing. There's something growing inside her, something that shouldn't exist. This is the story of teratomas, tumors that grow hair, teeth, eyes, even brain tissue. Tumors that contain pieces of human beings. But they're not parasites. They're not absorbed twins. There's something stranger, something that exists in a gray zone between life and tissue, between human and tumor, between miracle and nightmare. Teratomas are found in patients worldwide. Thousands of cases every year. Most people never hear about them, because doctors don't talk about them casually, because the reality is too disturbing, too bizarre, too likely to cause panic. But these tumors exist. They're real, and they're growing inside people right now, waiting to be discovered. The word teratoma comes from Greek. Teratos means monster. Oma means tumor. Monster tumor. The name is ancient, because people have known about these growths for thousands of years. Archaeological evidence shows teratomas in mummies, in medieval remains. Throughout human history, these tumors have been terrifying people, confusing doctors, challenging our understanding of biology. A typical teratoma contains multiple tissue types: skin, hair, muscle, bone, fat. These tissues grow in chaotic arrangements. A clump of hair next to a tooth, an eyeball next to cartilage. Nothing is organized. Nothing follows normal body patterns. It's like someone took random body parts, mixed them in a bowl, and let them grow wherever they landed. The most common location is the ovaries. Women discover them during routine examinations, or when symptoms appear: abdominal pain, bloating, pressure, difficulty urinating. The tumor grows silently for years, getting larger, adding more tissue types, building its grotesque collection, until it becomes too big to ignore, until it causes problems, until a doctor finally looks inside. But teratomas also grow in testicles, in the brain, in the tailbone area, in the chest cavity, in the stomach, anywhere germ cells exist. Germ cells are the cells that become eggs or sperm. They contain the instructions to build an entire human. Under normal circumstances, these cells wait. They remain dormant. They activate only during reproduction, but sometimes they activate spontaneously. They start building, without fertilization, without pregnancy, just building randomly. When a germ cell activates incorrectly, it gets confused. It tries to build a human, but it has no blueprint, no guidance, no organization. So it builds everything at once. It creates skin cells, then tooth cells, then brain cells, all simultaneously, all in the same tiny space. The result is a teratoma, a tumor containing pieces of a person who never existed, fragments of a human that was never meant to be. The teeth in teratomas are real teeth, fully formed, with enamel, with roots, with nerves. They're not tooth-shaped tumors. They're actual teeth. Dentists who examine them confirm this. These teeth could theoretically function. They could chew. They could feel pain. But they're trapped inside a tumor, inside someone's ovary or testicle, growing in darkness, serving no purpose, existing pointlessly. The eyes are even more disturbing. Teratomas can grow structures that resemble eyes, with lenses, with retinas, with optic nerve tissue. Some even respond to light. They have photoreceptor cells, cells that detect illumination. But they can't see. They're not connected to brains. They're not connected to anything. They're eyes that stare at nothing. Eyes that exist in perpetual darkness. Eyes that will never witness anything. Hair in teratomas grows normally. It extends. It can be long, several inches sometimes. The hair has follicles. It has pigmentation. It matches the patient's genetic code because it's made from their cells, their DNA. It's their hair, growing in the wrong place. In a tumor instead of scalp. In an ovary instead of on a head. Biology functioning perfectly, but in the wrong context. Some teratomas contain brain tissue. actual neurons, cells capable of electrical activity. In rare cases, these cells generate signals, brain waves, measurable activity. Does this mean the tumor is conscious? No. Consciousness requires organization, connection, structure. A teratoma's brain tissue is random, isolated, meaningless, but still disturbing. The idea that tumors can generate thoughts, even meaningless ones, even random electrical noise. Most teratomas are benign. They don't spread. They don't metastasize. They just sit there, growing slowly, adding tissues, becoming more complex, more bizarre, more monstrous. Doctors remove them surgically. The procedure is usually straightforward. Find a tumor, cut out, close the incision. The patient recovers. The tumor goes to pathology, where someone has the unfortunate job of examining it, of cataloging its contents, of documenting every tooth, every hair, every nightmare component. But some teratomas are malignant. These are called immature teratomas. They contain embryonic tissue that's still dividing rapidly, still growing aggressively. These tumors can spread. They can invade surrounding organs. They can kill. Treatment requires surgery plus chemotherapy. The prognosis depends on how early it's caught, how much it has spread, how aggressive the cells are. There's a related condition called fetus in fetu. It's often confused with teratomas, but it's different. Fetus in fetu occurs when one twin absorbs another during early development. The absorbed twin becomes trapped inside. It continues growing, but it's not a tumor. It's a malformed twin. It can have limbs, a torso, sometimes a partially formed head. It's more organized than a teratoma, more recognizably human, more horrifying in a different way. Teratomas are different. They're not absorbed twins. They're not parasites. They're spontaneous growths, products of cellular confusion, germ cells that activated without permission, without purpose, without any logical reason. They're accidents, biological glitches, mistakes written into human DNA, possibilities that occasionally become realities. Patients who discover they have teratomas experience intense psychological trauma. Imagine being told there are teeth inside you, growing where teeth shouldn't exist, or eyes, or hair. The mind rebels against this information. It seems impossible, like science fiction, like horror movies, but it's real. It's happening. It's in your body right now, waiting to be removed. Doctors have to handle these conversations carefully. They explain the tumor is benign. That removal is usually simple, that the patient will recover completely. But they can't erase the fundamental horror. The knowledge that your body grew pieces of another human, or pieces that could have been another human, or pieces that exist in some undefined state between human and not human. The removed tumors are sometimes photographed for medical records, for education, for research. These images circulate in medical schools, in textbooks, in online medical forums. They show masses of tissue, with visible teeth jutting out, with hair clumps clearly visible, with eye-like structures staring emptily. These images are deeply unsettling, even for medical professionals, even for people who see disturbing things daily. After surgery, patients often ask questions. Can the tumor feel pain? Was it alive? Did it have consciousness? Doctors explain that tumors aren't conscious. They're just cells, cells following instructions, cells building structures. But without organization, without connection, those structures mean nothing. The teeth can't bite. The eyes can't see. The brain tissue can't think. It's all potential without actualization. Biology without purpose. Some cultures throughout history interpreted teratomas as demonic possession, as evidence of evil spirits, as curses or punishment. Medieval doctors called them demon tumors. They performed exorcisms. They tried magical remedies. Because what else could explain teeth growing in ovaries? What else could explain eyes where eyes shouldn't be? Modern science provides explanations, but the visceral horror remains unchanged. Teratomas raise philosophical questions about identity and humanity. What makes something human? Is it DNA? Teratomas have human DNA. Is it structure? Teratomas have human structures. Is it consciousness? Some teratoma brain tissue shows electrical activity. Is it organization? That's the key difference. Organization, connection, purpose. Teratomas have components but no system, parts but no whole, potential but no realization. The medical community has studied teratomas extensively. Research focuses on understanding why germ cells activate spontaneously. What triggers the process? What could prevent it? Scientists examine the molecular signals, the genetic switches, the cellular communication errors. Every teratoma removed becomes a data point, a piece of a larger puzzle, a clue to understanding human development. Some researchers use teratomas deliberately. In stem cell research, they inject stem cells into mice. The cells form teratomas. Scientists then examine what tissues developed. This confirms the stem cells are pluripotent, capable of becoming any tissue type. It's useful research, but deeply ironic, creating monster tumors intentionally to prove cells work correctly, to advance medical science. Teratomas occur in approximately 1 in 500 people. That's more common than most realize. Not everyone develops symptoms. Not everyone gets diagnosed. Some teratomas remain small, undetected. They live and die with their hosts, never causing problems, never being discovered. Silent passengers in human bodies, carrying their teeth and hair and eyes to the grave. Young women are most commonly affected. Teratomas peak during reproductive years, 20s and 30s, when ovaries are most active, when germ cells are most likely to malfunction. But teratomas can occur at any age. Infants can have them. Elderly patients can develop them. Age provides no immunity, no protection, no guarantee. The largest teratoma ever recorded weighed over 60 pounds. It grew in a woman's abdomen for years. She thought she was gaining weight. She thought she was just getting older, her metabolism slowing down. But she was actually carrying a massive tumor. A tumor full of tissue, full of teeth, full of hair, full of horror. When doctors finally removed it, they were asked, how had she survived? How had she functioned? How had she not known? Most teratomas are much smaller, a few centimeters across, the size of a golf ball or tennis ball. Still disturbing, still containing multiple tissue types, but manageable, removable, survivable. Patients recover quickly. They return to normal life. They try to forget. They try not to think about what was inside them, what their body created without permission, what biology did without asking. There's no way to prevent teratomas. No diet eliminates risk. No lifestyle change helps. No medication stops them. They occur randomly, spontaneously, without warning, without reason. They're built into human biology, into the way germ cells function, into the fundamental mechanics of reproduction. We carry the potential for teratomas in our DNA, in every germ cell, in every egg and sperm, the potential to create monsters instead of humans. After removal, teratomas are disposed of as medical waste. They're incinerated, destroyed, erased, but photographs remain. Medical records persist. The knowledge continues. Each case adds to our understanding. Each tumor teaches us something about development, about cells, about the thin line between normal and abnormal, between human and tumor, between life and growth. Patients who've had teratomas removed often keep the experience private. They don't discuss it. They don't share. Because how do you explain? How do you tell someone that doctors found teeth inside your ovary? That there were eyes in your abdomen? That your body grew pieces of a person who never existed? The words sound insane. The reality sounds impossible. Better to stay silent. Better to pretend it never happened. But it did happen. It happens constantly. Right now, somewhere a doctor is looking at an ultrasound, seeing teeth where teeth shouldn't be, seeing an eye staring back, seeing a teratoma. They'll schedule surgery. They'll remove it. They'll send it to pathology. And the cycle continues. The monster tumors keep growing, keep appearing, keep reminding us that biology is stranger than we imagine, more unpredictable than we'd like, more capable of horror than we're comfortable admitting. Teratomas prove something fundamental about human bodies. We're not perfectly designed machines. We're chaotic systems. Systems that usually work, usually build correctly, usually follow the rules, but sometimes don't. Sometimes malfunction. Sometimes create teeth in ovaries, eyes in tumors, hair in darkness. And when that happens, all we can do is remove them, study them, learn from them, and try not to think too hard about what they represent, about what they mean, about what else our bodies might create without asking, without warning, without mercy.